I'm Dr. David Schwartzberg, and let's discuss stoma locations. This is a patient, and this is their right side, and this is their left side. Here's their rib cage. Here's their anterior superior iliac spine, and then here's their pubis, which makes this the rectus sheath, which is the six-pack muscles. This is very important because ideally what you want to do is make a triangle between the pubis, the umbilicus, and the superior anterior iliac spine. And right in the middle is the ideal location for a stoma. In the middle of the rectus sheath, we know decreases the risk of a parastomal hernia. So this can safely fit the flange and safely fit the bag. Some things we run into, though, are sometimes patients have a crease. It may not be evident when they're laying down, but when they stand up, there's a crease here. If there's a crease too close to the stoma, there's going to be a leak. So you may have to move the stoma down, but now we're getting a little close to the pubis, so you may have to move it up. And if you're going to move it up, you want to keep it within the rectus sheath. You want to keep it away from the belly button because sometimes there can be a crease associated with the belly button that also can cause a leak. You want to keep it in a nice flat area where the flange can have a good seal without any creases near it, and therefore we'll have less of a chance of a leak, and because it's in the rectus, less of a chance of a hernia. Now, another thing is that ideally, we talked about this stoma triangle and how this is the ideal location right in the middle for a stoma. However, there are some reasons to put them in different locations. For instance, if here's someone who's trying to change their bag and they're trying to look down, and this location correlates with the bag that's here, well, that patient's not going to be able to see. So you may have to move the stoma upwards here, away from the rib cage, but that will correlate to a bag that's here, and that the patient can easily see. So that's another reason that body habitus and anatomy may dictate where the stoma should be located. Lastly, people's abdominal wall is thinner up here and it gets thicker. So sometimes the bowel may not reach to the abdominal wall and this lower location, so you have to move it up because, again, the abdominal wall is thinner. So there's all these considerations that we have to think about. But ideally, you want it within the rectus, a flat area away from any creases, and that's going to give the best chance of having a good seal when it's pouched, and always thinking 2 and 3 steps ahead. How can a stoma be created that makes its reversal, if possible, more straightforward? Thank you.